Welcome to the Pink Power podcast, where I'm raising awareness and spreading facts and knowledge about breast cancer. Today is my first ever episode, and we are talking about something super important: early detection of breast cancer. Early detection can literally save your life. By catching breast cancer early, the survival rate is much higher and treatments can be more effective. In this episode, I'm going to teach you on how to do a breast self-examination right in the comfort of your own home, what signs and symptoms to look out for, and what to do if you suspect you have breast cancer. So stay tuned and be informed. Knowing what to look out for can make all the difference when it comes to early detection. Here are some key symptoms to keep in mind. Number one, nipple changes. If you notice any changes in your nipples, such as inversion, which is pulling inward, or unusual discharge, especially if it's bloody, it's important to get it checked. Number two, swelling of all or part of the breast. Swelling doesn't always come with the lump. If you see unexplained swelling in all or part of your breast, it's worth talking to a healthcare provider. Number three, bloody discharge. If you notice any blood or other abnormal fluid coming from your nipples, it's a good idea to get it examined by a doctor. Number four, destruction of skin. Look out for any unusual changes in the skin of your breast, like redness, thickening, or scaling. These can sometimes be signs of breast cancer. Number five, pain in the breast. While breast pain is common for many women, especially around their menstrual cycle, persistent pain in one spot could be a warning sign. Number six, dimpled or depressed skin. If the skin on your breast starts to look dimpled or puckered, almost like the skin of an orange, this could be a sign of an underlying issue. Number seven, lump in the breast. One of the most well-known symptoms is a lump in the breast. It may feel hard or irregular, and it's important to have it checked out immediately. Number eight, visible lump in the armpit. Finally, don't forget to check your armpits. Swollen lymph nodes or a visible lump in the armpit could also be a sign of breast cancer. Last but certainly not least, I'm going to explain how to do a breast self-examination. This is a quick and easy way to stay on top of your health and spot any changes early. Doctors recommend doing a self-exam once a month, preferably at the same time each month, like a few days after your period when your breasts are less tender. Step number one, stand in front of a mirror. Start by standing in front of a mirror with your shoulders straight and your arms on your hips. Look for any visible changes in size, shape, or color. Make sure there is no swelling, dimpling, or puckering of the skin. If your nipples have changed position or become inverted, take note. Step number two, raise your arm above your head and look for the same changes. This position can sometimes highlight things you might not see with your arms at your side. Check if both breasts move the same way or if there's any noticeable difference. Step number three, feel your breast while standing. Now it's time to feel your breast. Use the pads of your three middle fingers and move them in a circular motion, covering the entire breast from top to bottom and side to side. You can start from the collarbone down to the top of your abdomen and from your armpit to the center of your chest. Press gently at first, then increase the pressure slightly to feel deeper tissue. This is easiest to do in the shower, where your fingers can glide smoothly over the skin. Step number four, feel your breast while lying down. Lastly, lie down on your back and repeat the process. When you are lying down, the breast tissue spreads out evenly, making it easier to feel for any abnormalities. Don't forget to check the area around your armpit as well, since breast tissue extends there. If you notice any lumps, thickened area, or anything that feels unusual, don't panic. Most breast changes aren't cancerous, but it is always best to consult your doctor immediately. Thank you for joining me on this episode of the Pink Power podcast. See you soon.